Hi, my name's Zaynab. I'm a third year medical student at the University of Sheffield, and I'm currently undertaking a placement with Mr. Abdul at the Delta Centre. Today, I'll be giving a presentation on step down and intensive care for both pre and post operative patients. What I'll be going through is what is step down and intensive care and the criteria for admission into these units for surgical patients specifically. Now, just a bit of an introduction on what these both are. Intensive care is specialized hospital wards that are used for patients who are critically ill. Step down care is an intermediate level of care for patients who are in between intensive care and general wards. Now, throughout the phases of surgery, patients will experience multiple systems and it's all dependent on the level of care they require at that period. Now, looking closer into intensive care, some of the features of the intensive care unit is continuous monitoring, which is really crucial for critically ill patients, that they are closely and continuously monitored. Life support is available, respiratory support equipment is available, and rapid intervention is possible. The reason rapid intervention is possible is because all of that equipment that is required is a bit more readily available, and because of the smaller staff to patient ratio, so staff are able to readily intervene when there are issues that occur. The surgical ICU tends to manage any post-operative patients who have undergone major surgeries, any unstable trauma patients, and overall any surgical patient who requires close monitoring or who requires life support. Moving on to the specifics of step down care. Step down care can be used for a few types of patients. So, number one, anyone who no longer requires ICU level of care, so therefore they'd be stepping down. Number two, anyone who needs a step up from regular wards. So, regular wards may not quite be covering the care needs that they have, but ICU may be too advanced and maybe they don't need level of care that ICU would provide, for example. So, step down care would be a nice intermediate. And number three, any post operative patients. So, post operatively, patients may not be critically ill, for example, but they do still require closer monitoring than regular wards and they will have increased care needs. The reason they have increased care needs are a few different factors. So, one, any underlying comorbidities. We need to make sure that they are monitored to make sure any coexisting conditions are properly stable and the patients are not under any complications after surgery. The effects of surgical interventions. So surgery is does pose a large impact on the body, and it's important to make sure that patients have been monitored to identify any side effects, any complications, and make sure that the patients are stable after surgery. And lastly, there is a larger demand on nursing staff for post operative care needs. So, in the post operative period, there is a higher level of care needed. There is increased care needs because of the nature of recovery, and therefore, it is useful to have more nursing staff available for the patients that are there. Now, this gives us the question of where do we admit the surgical patients in the different stages of surgery. So, in the pre-operative stage, surgical patients tend to only be admitted into ICU or step down for a few reasons. So, this could be one, if they have any severe unstable medical conditions which require monitoring. So, it is important to make sure that any pre existing conditions are carefully monitored and carefully made sure that they are completely stable before the surgery to reduce any complications occurring in the surgery. Any patient who's admitted due to trauma, so often any trauma patients may come in, for example, and may be too unstable for any operations, but they can stay in either ICU or step down units whilst they are monitored until they are stable enough and fit enough for surgery. And overall, just any high risk patients, anyone who's got pre existing conditions, anyone perhaps the nature of the surgery makes it a higher risk patient, and anybody who's already critically quite ill, such as elderly patients or patients with low comorbidities. Moving on to post-operatively, where should patients be? So patients will be usually in ICU or step down units. The reason they may be in the ICU is number one, if there's any planned complex procedures. So, for example, organ transplants or open heart surgeries, these are much higher risk surgeries, and therefore, in the recovery period, we do want to make sure that we are closely monitoring them and that we are able to rapidly intervene if there are any complications. They also do have much higher care needs and demand for the nursing staff when they are post op because of nature of recovering from such intense surgeries. And the second reason may be if there were any unplanned complications. So this could be increased blood loss, unstable vital signs, any breathing difficulties. We do want to make sure that they are closely monitored and checked in the period after surgery. The other option would be a step down unit. And as I mentioned earlier, the patients may be generally quite well, but they will still require some stricter monitoring than general wards, purely just because of the nature of surgery and recovery. Therefore, really, the choice post operatively is between ICU and step down, and it's generally they are not admitted into general wards. However, some lower risk surgeries may mean that patients go into general wards. And overall, it does just depend on the trust guidelines and the hospital guidelines on where patients are placed. But generally, for step down units, they may transition from ICU first, or they may go directly from the recovery room straight into step down units. And these are some of the patient criteria when we're considering whether we should be putting them in step down units. So, this would be that they have reduced levels of care needed, that they have stable vital signs, that they have hemodynamic stability, and that they have improved respiratory rates. Now, just to summarize what we've been through, step down care is an intermediate between general wards and intensive care. It's often used for surgical patients to provide them the adequate monitoring that they need, both in the pre and post operative stages. Step down care is beneficial because it reduces the burden on ICU while still making sure that the patients are being provided the appropriate care that they need, specifically for patients who are not really suitable for admission into the regular wards. Thank you so much for listening.